Are there self-help tips for nyctophobia? Are you or someone you know struggling with nyctophobia, the fear of the dark? If so, you might be wondering if there are self-help strategies that can make a difference. The good news is that there are effective techniques aligned with cognitive therapy principles that can help manage this fear. Cognitive therapy focuses on changing unhelpful thoughts and behaviors, making it a great approach for those dealing with anxiety related to darkness. One of the first steps is to understand and challenge your fearful thoughts. Take a moment to notice what specific thoughts trigger your fear when you are in the dark. You might find yourself imagining danger or harm. Cognitive therapy encourages you to question these thoughts. Ask yourself if they are accurate and try to replace them with more realistic and reassuring ones. For instance, remind yourself that darkness itself is not harmful and that your fears are often exaggerated. Another helpful technique is gradual exposure to darkness. This is a common method in cognitive therapy known as systematic desensitization. Start by exposing yourself to dim lighting and gradually reduce the light over time. This allows your brain to learn that darkness is safe. By having repeated safe experiences, you can reduce your anxiety. In addition to exposure, relaxation techniques can be beneficial. Learning methods such as deep breathing, progressive muscle relaxation, or mindfulness can help manage the physical symptoms of anxiety when facing darkness. These techniques calm your nervous system, making it easier to cope with fear. Positive affirmations can also play a role in overcoming nyctophobia. Using statements like, "I am safe," or "I can handle this," can help reinforce your confidence. Repeat these affirmations during your exposure to darkness to build a sense of control over your fear. Creating a safe environment is another practical tip. Initially, you might want to use a nightlight or leave a door slightly open to feel more secure while practicing exposure. As you gain confidence, you can gradually reduce these aids. Keeping a fear journal can also be a useful tool. Write down your experiences, thoughts, and any progress you make. This practice helps you track your triggers and improvements, making your thought patterns more visible and manageable. Finally, seeking social support can be very helpful. Sharing your experiences with trusted friends or family can provide encouragement and reduce feelings of isolation. These self-help strategies reflected the principles of cognitive therapy, focusing on changing thought patterns and behaviors to reduce fear. While these techniques can be effective, remember that severe nyctophobia may require guidance from a mental health professional trained in cognitive behavioral therapy and exposure techniques for more structured support.